Namaste, Salam Bhagia. Welcome to Manthan with Saraswati, a space where stories inspire, cultures connect, and learning becomes meaningful. I am Saraswati Suresh, an educator with over 3 decades of experience. And this platform is my way of bringing together children, parents, teachers, and the wider community to reflect, grow, and celebrate life. Each episode is crafted to spark ideas, uplift your spirit, and encourage your next bold step. So stay with us, like, subscribe, share, and join this journey of ideas, culture, and inspiration. Together, let's celebrate the voices shaping our future. Namaste and a very warm welcome to Manthan with Saraswati. Today, we have gathered here not just for a conversation, but for courage. Cancer, a word that shakes hearts, homes, and hopes. Yet, it is also a word that has revealed the deepest strength in so many women. This episode is not about fear. It's about honesty, healing, and reclaiming the power. Sitting with me today, here is a visionary oncologist, someone who has held hands, wiped tears, and guided women through the delicate moment or the fragile moments of their lives. So let's welcome Dr. Findy Prasetyawati to Manthan with Saraswati. She is a general practitioner, specialty in internal medicine, subspecialty in hematology and medical oncology from University of Indonesia. Not just this, she currently holds the position in teaching in University of Indonesia, subspecialty doctor in Mitra Kaluwarga Kamayaran Hospital, active member in various national and international professional association. And I'm really honored to welcome you to the show, Dr. Findy. In this eye-opening talk show, we have three extraordinary women, Sonia Taneja, Prachi Jaiswal, and Sunita Lakhotia, who are the warriors who have fought an invisible enemy, transformed their struggles, and walked through their life's darkest storm and emerged shining, turning their pain into purpose and their fear into fierce, radiant strength. And we truly wish that may this conversation echo into every home where a woman is silently worrying about her health. So today, let's listen up with empathy, speak with truth, and create a circle of awareness that reaches every home. If today's conversation touches your heart somewhere, do a moment to like, subscribe, and hit the icon button and be updated with our upcoming episodes on this amazing show of Manthan with Saraswati, and share it, because only when you share that the awareness grows and we can help spread such a lovely message which the girls and Dr. Findy is going to give us today. Thank you so much. So to tell you all, to begin, we have 4 segments into it, Dr. Findy. The first one will be, of course, the conversation with you. The second session, I call it Journeys of Courage with These Unbreakable Spirits.
Nice.
And third will be some audience have sent in some question. If we have time, we take it. Fourth is, of course, the thanking note. So, Dr. Findy, would you like to add something more to your introduction?
No, actually the introduction is okay. But thank you for inviting me.
Thank you.
Okay, so yes, well, I am very happy for these shows, because you aim to increase the awareness of cancer to others, so that it may be found in an earlier stage and becomes more curable. Yeah.
So I'm truly accept my heart gratitudes once again, and I want to once again thank my dear friends. Can we begin the show, Doctor? Okay, thank you. Doctor, You had seen so many people, and what is the first reaction most women have when they hear this word cancer? And just adding to that, what do you want them to know instead?
Okay, so well, in my experience, most women, when they hear cancer, they most immediately think of death sentence, or that they will lose everything, you know. But cancer, if they're found early, it certainly is, especially breast cancer. It's quite curable. It's the 5 year, even the 10 year survival is quite high, more than 90%. And after the treatment and everything, many people can still live fully, just as they were before they found the disease.
So that's a very optimistic note to start with. Very happy to know that, or if it is diagnosed earlier, they are good to go, and they
Yes.
are there for centuries, right? So doc, the word cancer itself is very terrifying, right? What are the most common myths around it? And I want you to bust the myths which is around it, and the people make. And just with the myth, is breast cancer always fatal?
Okay, so what myth do I want to bust? One is that cancer means death.
Okay. Cancer means death is what you want to bust.
No, yeah, because cancer does not always mean death. Especially, with all the advances that we have right now for the early detection, for the screening, and the targeted therapy and everything. Actually, the outlook is quite good right now. So, and many women, after they are diagnosed with cancer.
Okay. You mean to say after the initial treatment, they
Yeah.
live long
Yes.
after it? Okay.
Yeah, many women actually live very well and long.
So, doc, once they get diagnosed with cancer, what is the treatment journey usually look like?
Okay, so once someone is diagnosed with cancer, then the next thing to do is to know the subtype of the cancer and the stage of the cancer. Okay, so when we know the biological behavior of the cancer and also the stage of the cancer, then we will know what to do. Whether you require surgery first, or you require certain drugs first prior to surgery, and after surgery, if you need radiotherapy, sometimes some patients need chemotherapy or endocrine therapy or targeted therapy. It's actually depends on the type of the cancer and the stage.
Okay. So, as you say that there are so many methods available, but cancer treatment is not just medicine. Although
Yes.
you say that there are so many things available, so many therapies are available, and the diagnosis can be done very easily, but it touches relationship, right? Finances, the sleep, and even sometimes the identity of the person also. So, how much does the lifestyle, like diet, stress, sleep, etc., influence this risk of cancer? I'm sure ladies who are going to watch us on a talk show would definitely like to know, because their day and they spend the day in stress, let it be family, husband, children. So your answer is definitely going to make a lot of difference to the woman.
Okay, so actually lifestyle does not replace treatment. Okay, but certain lifestyles, when you reduce stress, when you eat better, when you exercise more, they have been shown to reduce the risk of cancer. And also in the long term, of course, you will gain health benefit from them.
So if you say eat healthy, so what's that in one line, if you would like to say?
Okay,
Eat healthy.
Eat healthy, eat plenty of vegetables, fruits,
Okay.
more fibers, less processed meat. You know, you can eat less refined sugar, more whole food.
Great. Thank you so much for that, Doc. And the second would be stress. Because see, women, if you say we women, we feel that we carry the entire weight of the universe on our heads, right? So any one tip you would like to share with the woman, that what is that one thing you would suggest that the stress can go down? Any one idea which you have advised to many patients and the lady women who are going through this tough time?
Okay, so it's not your fault. So
Yeah.
many patients came to me and said, I have eaten healthily, I have exercised regularly. Why do I still have the disease? But it's really not your fault. It's not anybody's fault. Okay, so there are many factors that can increase your risk of disease, and one of them is that you're a female. So, well, I mean, yeah, 1 in 7 females have the risk of getting breast cancer. So, yeah, it's really not your fault. So, take your mind off it.
Yeah. Thank you so much, Dr. Findy, for telling us about the risk factor and what kind of diet has to be maintained. My next question would be like, what are the simplest early warning signs which women should never ignore?
Okay, so the early signs that a woman should never ignore is a new lump in your breast or in your armpit. Okay. And of course, a change in breast size, a change in breast shape. When you see the right and left side is not the same, you have to be more aware. And some skin changes on the breast is also that's also something that you have to look out for. And also, if there's a change in the nipples, whether it's a wound or something itchy, you know, okay, or a retraction of the nipple. Well, if the nipple is inverted, you have to be more aware of the possibility that it is something.
Okay,
dangerous.
that's something they need to visit the doctor.
Yes.
So thank you for explaining that so beautifully, because many of the time, I think ladies do ignore it. They may be aware. Today we have the AI is to tell you, and today we have earlier we had Google, now it's the AI is telling you each and everything. But I really wish that women who are listening to us would look into all these things and do the needful or be aware of the signals. Thank you so much for that. What are the biggest, because you said that this is how we can diagnose and these are the early symptoms. I think what are the biggest advances that give you hope for people diagnosed today? What are the biggest advances?
Okay, so the biggest advances that give us hope is, of course, the method of early detection. Okay, so earlier we have ultrasound and mammograms. Now we have more advanced techniques, such as breast MRI to see more and to detect very difficult cases or very early cases. And then, of course, the advances in treatment, where we can have more personalized treatment, where not all of the patients may need chemotherapy. Sometimes the more personalized medicine is more effective, and oftentimes they also have fewer side effects. So I think it really gives us hope.
So that's good news here, doctor.
Yes.
That's good news, right? Now for any woman who is undergoing this kind of health issue, for families who support a patient, right? What truly helps a woman going through this journey?
Okay, so we can start from practical aspects, just take them to the doctors, to the hospital, transport, logistics, help with childcare. That's very helpful. And then you can have the non-judgmental
approach.
support. Just be there. If they feel something, listen. Don't just say you're just a crybaby or something like that. No, don't do that. Okay, so it will be very supportive for the patient, I think.
I just want to ask you, have you ever had an incident where a patient comes to you with a non-supportive background? Do you have that, and how do you deal with it, doctor?
Okay, so actually I do. Well, I do. So sometimes even to come for hospital visits, they are too busy to take the patient to the hospital. And then sometimes they make the patient think twice about going to the doctors. In Indonesia, very many people believe in the traditional medicine or alternative medicine, the unproven ones. Okay, so it's very difficult to treat these patients because sometimes they just don't come back for months or sometimes even up to a year, and then they come back with this big lump or sometimes more advanced stage, which is more difficult to treat. Okay, so well, in these cases sometimes I do family meetings. Okay, family meetings, I will try to talk with all the families that is involved with the patient care and try to make them understand that this is not actually just the patient's fight alone. It's also a fight for the family as well. So they have to be supportive of each other because we want the best for the patient.
So do they listen to you?
Mostly, yes.
Good, because it's a woman, they have to, at least at this stage, they have to. Right? Okay. Doctor, we are talking about women and how they have to be supported and all that. So what is the nutrition do you strongly recommend, especially for women in their 30s, 40s and 50s? I mean, does it vary from 30s when you move to 40s and when you move to 50s? Does it vary, or any nutritional care you would like to mention?
Actually, nutrition, I always recommend the balanced one, where you eat as much as your body needs and not excessively, not more than what your body needs. You can actually count your calorie needs, and then you can divide that like 30 to 40% of carbs, and then 10 to 15% of fat, and then the rest is protein. That's for the macros. And I will recommend them to have some things from whole foods, just real food, and don't don't process the food too much. Because then they will lose their nutritional value. Okay, and then eat a lot of greens, for your gut health. Okay, and then fibers, a lot of fibers, and then just enough protein and balanced diet. I think it's very good.
Okay.
Supplemental nutrition, I think it will be very helpful for someone who cannot eat their whole food. Okay, sometimes some patients, it's not for breast cancer, but some patients sometimes may not be able to eat whole food. So if they cannot eat whole food, or during your treatment you feel nausea, or you cannot eat as per your usual diet, then the liquid one will be much better and it's much easier to digest. So it's on top of your diet if you cannot eat your balanced diet. But if you're okay, I think the balanced diet is the best one.
Is the best.
Yes, just reduce refined sugar, reduce processed meat.
I think that was a wonderful summed up about the nutrition. I think this not just applies to the other women who
Everyone,
are
yeah.
undergoing treatment or anything, but it's generally 30, 40, 50 years, because there's a hormonal drop. I mean, you're a doctor, so your advice would reach the ladies much
I
better.
hope so.
Thank you. Yeah, I hope. And I hope and I pray that it reaches them, When you say, we talked about various kind of therapies available, and to diagnose, the first one is mammogram. So my question is, many women who are watching us today might be wondering, are mammograms just enough talk, or to start with and to take care of the thing, is the mammogram enough?
Okay, so mammogram actually has been proven for years to be a very good tool for early detection, and it has actually saved the lives of many. Okay, so I think mammogram is a very good one to start, a very good way to start. But of course, with some cases, if the mammogram finds something suspicious, but it cannot be confirmed, there are more advanced techniques, such as the one that I have mentioned before, MRI,
yes.
breast MRI. And mammogram can also be complemented with breast ultrasound. Okay, in the hand of an expert, breast ultrasound also is a very powerful technique. Yes.
Thank you, Dr. Findy, for telling us about the mammogram and the other, steps which we have to go if something is spotted in the thing. I also get my mammogram once in 2 years. So far so good. My next question, which I would really love to ask you, is cancer predictable, doc? Is cancer predictable?
Predictable?
Huh?
Okay. Well, there are some tools to predict, okay, if you have a high risk of cancer or not. Okay. From the family history, if your mom have breast cancer, then you have an increased risk of breast cancer also. And if you have obesity, or if you have some kind of radiation to your chest wall, it also increases your risk of getting breast cancer. So yes, some people have a higher risk of breast cancer, and it can be predicted. The recommendation for early detection for people with high risk and people with lower risk is a bit different. So for people with lower risk of getting breast cancer, they are recommended to have mammograms every 1 or 2 years since the age of 40. Okay, but people with higher risk of getting breast cancer, such as if they have hereditary breast cancer, some people have germline mutation of BRCA, then they are recommended to have early detection from the age of 20 or 25 years old, depends on where you live. Okay, so there's a bit of a difference in the early detection for people with high risk and low risk. Okay.
That was a wonderful message. You'd like to continue with the message?
Well, cancer it's not fully preventable. So there's a difference between prevention and early detection. Prevention is some efforts that we do to prevent us from getting a certain disease. So don't be too overweight, okay? And then healthy diet, such as mentioned before, regular exercise. That is prevention. But early detection is the effort or something that we do to diagnose certain disease, such as cancer, when we still do not have symptoms. Because most of the disease, while in its early stage, they are actually not symptomatic. Okay, you may not feel anything, but you may find something in your early detection, in your screening. So Those are two different things, but those are two very important things for breast cancer.
Dr. Findy, thank you for giving us a perspective of what is prevention and how early detection. So these two things are, different. And thank you for, highlighting it out to the people on Manthan with Saraswathi. If I could ask you one question, someone sitting at home who is terrified right now, what would you say to them?
Okay, so what I will say is that you are not alone. So many people have been in your place right now, and many people have been through what you are getting through right now, and many people have lived fully after all the treatment that they're getting. But it's not your fight alone. You have your family, hopefully, to be supportive. Yes,
family, hopefully.
Yeah, and you can talk to your oncology team, for the further treatment. And well, some things, some disease just can't wait for too long. So the earlier you are diagnosed, the better your chance of cure is. And there is a chance of cure.
Okay. My last question, Doc. What is that one message you wish every woman watching this episode would remember? What do you think that message of Dr. Findy is going to be?
Okay, so my message is that know your body. Okay, follow with the early detection recommendation with the routine screening, and know that breast cancer, if found early, is a very curable disease.
Thank you so much, Dr. Fendi. So we move on to our segment 2. Thank you for your amazing answers. I mean, you answered the questions very patiently and very extensively also. So that, I'm sure people who are watching you on Manthan with Saraswathi, and my tag is Dare to Serve. So they will be benefited by it. We have, as I said, the segment 2, I'm calling them as Journey of Courage with these amazing ladies who are with me, are Unbreakable Spirits. Okay, so first let me go to Sonia Taneja. So my question to you, Sonia, and welcome to Manthan with Saraswathi. I'm very thankful to you for being a source for this program to happen also, Sonia. So it's deep gratitude to you for that. I just want you to share some of your thoughts through my questions. So if you're okay, can we start?
Yeah, I'm absolutely fine. Thank you.
So Sonia, take us back to the moment when you first heard about the diagnosis. What did it feel like?
When I was diagnosed with cancer, my first reaction, disbelief or denial that this cannot be happening to me. And I was totally in the dark because it doesn't run in the family. So I would say that I was totally lost. And this was diagnosed in Indonesia. So to get a second opinion and further test on it, luckily I got my brothers and my dad are doctors. So I decided to go to India to get further diagnosis done on it.
So when you met your family back home, how did they react? And what did you actually need from them, at least at that time?
In fact, you will not believe it that I decided to go ahead with my surgery here first. My sister-in-law booked her ticket, but later on we changed our minds and I decided to go to India. They were waiting for me with open arms, and in fact, I reached late in the night, and the very same night, my brother, who's a radiologist, did my ultrasound. He had arranged the doctors, he had arranged all the appointments for me, very supportive family, and they were there to help me. So it was a big relief, yes.
It's wonderful to know that you had such a supporting family at the time of being diagnosed. Yeah, so lucky.
Yes, extremely, extremely lucky.
Gratitudes to them. Yes, yes. So, Sonia, because I know you and you were working at that moment as a teacher. So, what kind of support did you get from the institution you taught, if you would like to share?
Yes, definitely. I'm very, very, very extremely grateful to my school, who was very supportive. I had done 11 years by then, but the school gave me and my family the assurance that her job is secured and that they'll wait for me. I would get regular messages from my boss, from my colleagues who would call me regularly, also to my boss, Mr. Cross, who would message me regularly. So they kept in touch to Miss Devi, my HR head. So that gave me a lot of reassurance that I'm needed, I'm wanted, and I'm valued. I would also like to thank my husband and my two children who flew all the way from Melbourne and Hong Kong to be with me and give me moral support. I would like to thank them also.
Yeah, that's so nice of them, right? Actually, it helps when such a supportive environment thrives around you. You tend to feel better, and then probably it makes you feel good, and that feel good factor makes you feel recover faster also. During your treatment, I know, like, we all go through a lot of, mental turmoils. So, what kept you going in that period?
I think I'm such a passionate teacher like you that you no, it's frank that I wanted to go back to my work and be with the kids. That also reminds me that the kids would video call and my other colleagues and I would speak to them. They were very supportive. I think just the idea of just going back to my work kept me going.
Okay, that's wonderful. I think that's the drive in you, which kept. So thank you so much for sharing that. My last question to you, Sonia: what message would you give women who are watching this show?
Well, that's a difficult question. I would say that take care of yourself, eat healthy, which we all know, and no stress, meditation, I would say, or maybe some kind of physical activities a must, like either you join Pilates or yoga. And yes, the biggest thing, practice gratitude.
Thank you so much, Sonia, for sharing that with us. In the presence of Dr. Findy, who is your oncologist also, and with team, and with people of Manthan, with Saraswathi, who watches.
I think I should add that thanks to you for finding me good enough to be called on the show. Of course, thank you so much. It's such an honor. Thank you.
Thank you so much. Thank you so much for that. So, friends, we have another guest, another daring woman on the show, Prachi Jaiswal. Thank you for joining the show today, and thank you for you will be a source for motivation to many and inspiration to many. I hope that we do what we are here for. So, when you got diagnosed, did cancer change the way you look at life?
Certainly it did. When I was diagnosed, I had all of my activities stopped. I couldn't cook, I couldn't walk, I couldn't work. So earlier, these activities were like chores to me. But later, I felt that this was the privilege I lost. I knew that I will be recovered soon, but the absence of these activities really made me feel like we should cherish the life, whether the things are small or big.
That's wonderful. That's wonderful. So, tell me more about your small routines that kept you positive during your treatment.
Okay. So during my treatment, things were a bit hectic for me. But to calm myself down, I did some light breathing, and praying and spending time with family was very helpful. By praying to God, I openly shown my gratitude and I acknowledged the blessings I had. Spending time with family was best healer for me. because their tremendous love and support was there with me. And no matter how sick I was, no matter how I looked, no matter how upset I was, their love was the same all the time. They always supported me. So all these three things really helped me throughout.
So you said that meditation and light breathing kept you, going, right? So what changed after you recovered?
I used to be drained, but still I kept going. I still kept going. So I stopped doing that. I just, I just pushed myself to, just take a break, take some rest. Then you get up and go again. That's what I did.
So that keeps you going.
Yes.
Taking a break and saying that, hey, body, your rest is important. That's wonderful. That's wonderful. Thank you for that. So, one last message you would like to give to the women who are watching us on the show?
To the women battling or not, you are not alone. I know sometimes it feels like that your world is falling apart, but you are stronger than you think. So ask for help. Trust your voice. Trust your limits. Trust that you deserve a real support. Take a break without apologizing. Just, you don't need to be perfect or fearless. You just need to be what you are. And lastly, always love yourself. That's my message.
I think that's a wonderful message, that love yourself, right? So that's amazing. That's very important.
If you love yourself, then only you'll be able to love others. Just be happy.
Others, yes, yes. Let's move on to Sunita Lakhotia, who is another friend of ours who is here to support and who is also here to share her thoughts and her ideas. So thank you, Sunita, for joining us today on Manthan with Saraswathi.
Thank you, Saraswathi, for having me.
It's a pleasure. Sunita, my few queries to you would be that, tell me that one life lesson cancer taught you that everyone should know.
You see, considering the lifestyle I was having and my physical fitness at that time, when I got to know that, I was diagnosed with cancer, like reports in my hand, and I'm saying, doctor, this is not possible. This cannot happen. So lesson learned was anything can happen anytime. So, just live in present, enjoy your present, and do whatever you like small things also. You go for your morning walks, you read, you call your friends, talk to them, meet friends. So don't leave anything for the future. So any perfect planned future is an illusion. So just do things right now. I think that's the biggest lesson. And it's not that we did not know it, or everyone knows it. But when such health crisis comes, it reminds you of that.
Lovely. That's a lovely and a very emotional and a very touchy message. So, my second question, what mindset helped you to stay strong during your hardest days?
See, certainly a positive thinking and faith in Almighty. And that was not only for the hardest day. Throughout my treatment, I kept this in mind that this is a temporary phase, and things will come back to normal. So whatever challenges I'm going through emotionally, physically, whatever is there, it's all temporary, and life will be back. So that mindset kept me going.
And you're glad that it is.
And people around us, my family also kept restating the same thing. So this is just a temporary phase.
So Sunita, after what you have gone through, what advice do you think you want every family to follow when supporting a patient?
See, this word cancer itself carries a lot of trauma and terror. So, and it's not only the patient who is suffering, it's the whole family who is involved. And so the first thing I would say is be with patient, if possible, physically. So if you're getting treatment in the same city, it's easy. But if it's in another city, please visit them as often as possible. My husband was with me throughout 6 months. My son was visited me multiple times. All my friends from here, whenever they were in Mumbai, they visited me. So that really gave big support. So be with them. They need your time. They need your attention. And second thing I would advise is take care of their diet, which is very important. and try to keep life to normal as much as possible. See, some days are hard, but some days when patient is feeling good, take them out, go to movies, play some games with them. Whatever makes them happy, do it, and keep the environment positive. Just support is what is needed. Medicine will work hard, and the support will take you out of it. Very easy. And I was very lucky to get all the support. My sister flew from Bangalore and she was with me throughout. So when many friends here said, you just take care of yourself, you concentrate on your treatment, here we'll take care of everything. So that support, I think families should give.
So one should be lucky enough to have that kind of a support here. Like how Dr. Findy says that family needs to understand, and the family support is so important here, Dr. Findy.
Yes.
So thank you, ladies, for joining us on Manthan with Saraswathi for this amazing episode, which is on breast cancer. And in the segment 3, if I have to ask you one of the questions, the others are, of course, you have answered them. But this one question came from a friend of mine, and she asked a question like, how often should women do a breast self-examine at home?
Okay, so for the breast self-examination at home, a woman should do it actually every month. For someone who still have their periods, for the premenopausal women, it should be every 1 week after their last period. Okay.
Yeah.
I think that will be more than sufficient.
So thank you for that answer, and I'm sure she would have got the answer after she watches my episode, of course, and Google is always there. You have answered this question, but I just want to take up this. Doctor, if my mother had breast cancer, should I be scared? Is heredity the biggest factor?
Okay, so for a woman whose mother has a breast cancer, they are recommended to have an earlier age of early detection. So when your mother is detected or diagnosed as having a breast cancer when she was 50 years old, then you will take that minus 20 years old, and from 30 years old, you should have early detection. Yeah.
Okay. Thank you so much, Doc. And thank you for the courage and your honesty, ladies. Today, we just didn't talk about cancer. We talked about humanity, clarity, awareness, and incredible courage. To the woman watching, your health is your power. Listen to your body, honor your body, don't delay screening, don't live in fear. Dr. Findy, is there any last final message you would like to end the show with?
Okay, so for those of you who has to go to undergo chemotherapy, just try to keep to your normal daily life. So if you in your daily life you you walk daily, then do that. If you practice yoga or you practice Pilates or anything else, it's okay, just do it. But you know your own body, just do not overdo it, but it can still be done.
Thank you. Thank you, Doctor. So that's it. You heard from Dr. Findy on her final message. So you got it, ladies. So deepest thank you to my friend Sonia, Prachi, and Sunita, who joined creating awareness. Your strength lights the way for thousands of women. My deepest thank you to Dr. Findy for enlightening us about breast cancer and bringing calm, truth, and hope to many with your own persona and with your advices. To our audience, thank you for your sincerity for logging in to Manthan with Saraswathi and supporting it wholeheartedly. Kindly like, comment, and share whatever touched you in this talk. This is Saraswathi for Manthan with Saraswathi signing off and saying bye-bye. Thank you very much.
Thank you.
Thank you. Thank you.